Hey everybody, it's Jim Prevost with Embrace the Shake. Sorry for the tardiness, had a little technical difficulty. Again, good to be back after a couple of weeks off. I had to take a break. Um, we'll talk about a couple of things tonight. We'll talk about the myths of Parkinson's disease, and I'm going to refer to my notes. Uh, in addition to that, I'm going to talk about what I've been experiencing for the past month or so and where it's taken me in my care plan. Daryl, thanks for being on tonight. Danny, good to see you. I know you guys are busy today at Limestone with the weather we had. Thank you for all the safety measures that you guys led and headed up, making sure that the campus was fully alerted with the weather, making sure everybody was sheltered in place. You guys are magnificent. Brother Mark Green, glad you're up and doing better. Marcus Quick, good man. Mark, good to see you as always. Dale Smiley, we were in the Legion together, and Joey White, good to see you. Brother Paul Fleming, can't say enough of what you've done for me and my family and the long-term 40 plus year friendship we've had. Daniel, I'll say this publicly. I have to say, for a small college, law enforcement agency, I truly believe that Limestone sets the standard for other colleges our size as far as the public safety initiatives that you guys have in place. In addition to that, the measures that you take to protect us and all the students, and that you guys know just about every student that walks the campus, all of our faculty and staff. So thanks a lot for what you guys do, keeping us safe. Christy Roberts Hammer, good to see you as always. So I'm going to move right along. Hey, Brian played football for me at Gaffney High School, great guy. Um, and I believe at West Junior High School as well. My brother Bob Bott, good to see you, brother. I want to talk about our sponsors quickly. And I want to assure you that the sponsors that I mentioned do not provide any monetary support. Hey, Kelsey Tilley, Miss Mutton Fudge. They do not provide any financial support whatsoever to Embrace the Shake of Parkinson's disease. What they do provide is time and effort, excuse me, emotional support, and helping people on the other end of Parkinson's disease. So I'd like to start off with Dee Hout at Magic City Canine. Dee has an inmate canine training program, and that's where Biggie's coming through. And Biggie will be with Maddie in February or March. She also owns Applause Your Paws in Miami, Florida. So if you're ever down that way, please visit with her. Hey, Maureen, good to see you. Thanks for coming on board tonight. It's been too long since we've talked. Angela Connor, as you know, with Rescue 22 Foundation. I can't say enough of, I could thank them every day of the week, and they would never really know the gratification I have for giving me Moose. It's just been a wonderful journey. I'd like to thank the 52, excuse me. Hey, Steve Palmer, best linebacker ever walked out of Gaffney High School. Great man, great singer. Has a wonderful gospel band. AC, I was just singing your praises with Rescue 22. Folks, please, when you use Amazon services for your online home purchases, please access the Rescue 22 link. Therefore, when you bring your services or you make your purchase, then Rescue 22 receives some financial support by their alliance. I believe I told that right. Angela, please correct me if I'm wrong. So I can't thank Rescue 22 enough for what they've done for me, and just a perfect fit with Moose and I. I'd like to thank Broad River Hemp on Lafayette Street in Shelby, North Carolina, for what they do for the veterans community. Some folks have um, some negative vibes with CBD. This does not have any THC in it, and it complies with the FDA standard and the North Carolina laws. CBD does benefit those with Parkinson's disease and other neurological disease and other types of neurological issues and psychosocial issues. So if you're ever in Shelby and you're in the market for hemp products, salves, tinctures, and I and the flowers type products, please stop by and see Broad River Hemp. Tell them that I sent you. Veterans receive a 20% discount. This is a veterans-owned business. So those are the folks I'd like to thank tonight. Again, the GoFundMe crowd, 52 donors. And I'll say this, 48 of those I've never met before. And thank you so much for bringing Biggie home. We appreciate it. You'll have to check with Mr. Pless, but I believe that's okay because it does not contain any THC. So Maureen, check with Mr. Pless out at the bus garage. He'll give you a straightforward answer. Hey, Aaron, good to see you. Miss you at Limestone. Earl, good to see you tonight. I'm going to go ahead and proceed on and talk about the 7 myths and realities about Parkinson's. This comes from Dr. Steve Beck, who's the Chief Science Officer of the Parkinson's Foundation. I apologize for the yawning again. I can't control that. That's terrible, Alex. Thanks for sharing that with us. Everybody, say a prayer for that young sailor that was killed overseas with our defending our country. Bob Sherman, good to see you. It was good as always, brother. The Parkinson's disease has a foundation, has an organization called My Parkinson's Team, and they're working with a company called Voyager Therapies. Now, this is off track as far as the 7 myths, but I'm a little off track tonight. Voyager Therapeutics, rather, want to let everybody know about a clinical study. It's called Restore One, and I'm reading verbatim. This is for people with advancing Parkinson's disease. The Restore One clinical study is evaluating an experimental gene therapy approach to see if it may help improve motor function. If your response to Parkinson's meds has become unpredictable or is not what it used to be, the clinical study may be an option for you. Welcome aboard, Penny. I'm reading the thing about a study, and I'll bring the information tomorrow when you guys come to boxing. To be eligible to participate in this study, good evening, Troop. Good to see you there, Jimmy Sherman. Have to be between 40 and 75. Being diagnosed with PD for at least 4 years, and notice that your motor symptoms are unpredictable, and despite medication. One other factor it doesn't mention, hey, John Barron, high school football friend, also wrestled at Mount Vernon High School as well, served our country, and great man. Thanks for coming on board tonight, John. Appreciate it. The study does involve a surgical procedure. They'll be used to administer the experimental one-time gene therapy. Prior to the procedure, study participants will be randomly assigned to 1 or 2 treatment groups, either the experimental gene group or the placebo group. And the study will require 21 visits over a period of 14 months. There's some other particulars. Reimbursement for the study-related activities, meals, transportation and parking may also be provided. If you're looking for this study, go to myparkinsonsteam.com. Again, My Parkinson's Team for the Restore One study. Personally, I do not qualify because I'm not into my 4th year of diagnosis yet. Hey, Charlotte, good to see you. Thanks for coming on tonight. Appreciate you. Jessica, good to see you as well. One of my former students at Shelby High School, great young lady. So let's go with the 7 myths. And like I said, I borrowed this from Dr. Stephen Beck, Chief Science Officer of the Parkinson's Foundation, and gave us permission to use this. And first myth is that Parkinson's disease is only a movement disorder. And that's false, as you all well know from watching the show. It does affect your movement in many ways, but it also affects with the non-motor, excuse me, like what you're seeing now. Also, it's known for creating the anxiety depression cycle, what we call the rabbit hole syndrome, low blood pressure to where sometimes folks do pass out. Constipation, just about everybody in our boxing group has issues with that, and that's caused by gastroparesis. And what gastroparesis is that where your intestinal tract has or loses the ability to push. Therefore, the exudate in the gastrointestinal tract, the waste matter is not able to be pushed out effectively because the intestines can't contract and relax like normal people's. And what happens there is constipation, which sometimes becomes septic. In addition to that, night sweats are rampant among the PD population. Hey, Rhonda Lale, good to see you, dear. Rhonda, if you don't mind, Rhonda Lale is one of my nurses, and she is absolutely magnificent. Just a positive person, outstanding, just does a fantastic job in my physician's office. Can't thank her enough for what she does for me. We also suffer from a lot of sleep issues, and often these are related to pain, which is very difficult to manage for a PD patient. Hey, Carmen Brown, undoubtedly one of the best athletic trainers I ever had come through Shelby High School as an intern, All-American swimmer at Limestone, and a mommy of 3 babies, and 2 of them are twins. So good to see you. I want to talk about if the person with Parkinson's disease look good, they must feel good, and that's another myth. Boy, is that a myth. Again, the depression, anxiety, and pain are the big 3 that we deal with that are non-motor. Also, loss of smell, speech disorders, hearing. It's just a plethora of symptoms that we have. Swallowing problems, gastrointestinal. What's often misdiagnosed as GERD is actually a softening of the alimentary canal, which is your swallowing canal, and food just gets hung up and stuck, and it's just awful. I would like to talk about the depression and anxiety cycle. Penny, if you want to address that, go right ahead. Not only do we have to worry about the depression that we have as Parkinson's patients, but also the depression that we can cause on our family as they watch us slowly deteriorate. Because our degree disease is progressive. There is no predicting the progression of the disease, and that it is well documented that we that we lose something every day. Um, moving forward, a person with PD not moving uh, much at all is often caused by, and this is also the part of like looks good, feels good. A lot of times we just sit and somebody says, because, we don't look like we're in pain, or we don't look like we have Parkinson's because we don't shake, and only 40% of us shake, then we must feel good. A lot of times we don't move is because we can't. And if we do move, it's very slow, which is called bradykinesia. And at the same time, our movements are very deliberate because our coordination loss becomes a discoordination, a dysfunctional coordination, not an uncoordination. So we have to be very deliberate about what we do. Yeah, weak legs too can either be motor or neurological. We're actually a vitamin deficiency, vitamin B. The third thing is people with PD blame the PD for every time they don't feel well. That's pretty much a blanket statement. PD causes a lot of problems for us, but fever is a sign of infection. But when you have constant or headaches and some vision loss or vertigo, that could be another neurological symptom, or a neurological symptom um, caused by the medication infarct. And a lot of times, what happens, we try to blame PD for it. Some folks blame PD, and actually, it's something that we need to get attended to. Chest pain, loss of sensation, and loss of muscle strength are not symptoms of Parkinson's disease. Um, I'm going to disagree with the numbness and the loss of sensation. Um, they misdiagnosed me for 5 years. No, it's not hereditary, um, Maureen, as far as that. If your grandmother has it, you has it, you have it. It is in the DNA. It's usually recessive, and rarely is it idiopathic, which means, like me, nobody in my family has it. So I'm the first. Um, but to say that that your uh, Parkinson's is hereditary, solely hereditary, is false. So somebody has to have it in your family for you to get it, and no, that's not right. It can be idiopathic. But yes, Maureen, in some cases, it runs in the family genes, much like dementia does. Eric Wilson, high school friend, um, great guy. Coach John Wall, now Principal John Wall, was my assistant principal when I was at Shelby High School. I learned a lot of my methods of being an assistant principal, courtesy of John, and I've always appreciated his support. Uh, Moving on to the myths and the legends of Parkinson's. Let's go to number 4. Parkinson's disease has flare-ups. Uh, Again, that is a myth. It doesn't have a flare up. Symptoms become exacerbated because either a drop in the dopamine or in the medication that artificially provides it. A flare up sometimes is considered an off time, where the medications is not working right, but actually a flare up of symptoms solely because of the Parkinson's. It really can. There's something usually that causes the so-called flare-up. Penny, you mentioned the weather. Um, I agree with you. Gary and I and Daryl, whenever the weather's rotten, we have a lot of problems with stiffness, and our movement slows down, and fatigue. So the environment, I think, doesn't cause a flare up. I think what it causes is an increase in the magnification of the symptoms. Um, Another thing is I want to talk solely on underlying cause, the often ignored nutrition, and the often ignored um, exercise um, is sometimes the culprit in the perceived flare up. As you can see, Alex is sharing tonight about her autism. Thank you for that, um, um, Alex. You're so kind to share your journey, um, but you've come a long way, and you're my hero, girl. You're my hero. You have your own place now, and the things that you mentioned that you had issues with, you've conquered, and you're a bright young woman, and got a great life ahead of you. So, thanks for sharing that. Um, the doctor can predict your disease progression. The question used to be, how long do I have? Because Parkinson's was perceived at one time as a fatal disease. It is not. Folks with Parkinson's do die traditionally earlier than others that don't have it, and we usually have other things that come on, other illnesses that come on board because of our inability to function, quote, um, um, normally. For example, cardiovascular loss, um, a fall-related death to where you may break your pelvis, and the fatality of people over 60 that break their pelvis is very high. Not healing up from a surgery, having, like I said, the gastrointestinal issues, and often is pneumonia. So it's usually a secondary item affiliated with. Command Sergeant Major Governor's on tonight. Good to see you, Larry. Coach Norman, undoubtedly the greatest football coach I ever worked with, and did so much for all sports at Shelby High School. All sports. Jimmy Martin, my good friend, thanks for being with us tonight. Feel free to jump in from your experiences, Jimmy, as well with disability management. My friend Daryl, has Parkinson's, really summed it up because Parkinson's varies from person to person. But Daryl got a quote from a video he saw. It says, "Once you've seen a Parkinson's patient, you've seen one Parkinson's patient." So we're all different. Um, we have some of the similar symptoms, but we're all different in our own way, and we all travel in different avenues. So you can improve your quality of life. It's a fact. Doesn't matter what stage you're in, just by eating right, exercising, and getting the proper sleep and rest. Um, Another myth is that the latest tea or vitamin or eating beets or one of these diet crazes will help you with your Parkinson's as far as help cure it and relieve the symptoms. That's false. Parkinson's does not have a cure. It doesn't look like it's going to have a cure from a long time, if ever. The major parts of the research that they're doing now is the work on the symptomatic relief, not necessarily, excuse me, not necessarily um, slowing down the progression of the disease. You have to treat the symptoms of a disease to find out how the disease responds. And then let's say if these symptoms respond, that can tunnel you to where you need to go as far as developing drugs that can halt those symptoms. If you halt those symptoms, then you can start moving to halting or slowing down the progression of disease. So it's tricky in the research and development, but maybe one day, I doubt it in my lifetime, but maybe one day they'll be able to find it, a cure, or at least something that slows it down. Stem cell research. There's been a lot of puff about stem cell research in the Parkinson's community. Several folks have sent me articles about it, and I really appreciate that. So when I contacted the PD Foundation, again, I apologize. That yawning's somewhat embarrassing. That I can't control that. Um, Stem cell research is now focused, like I told you a minute ago, on symptomatic relief. And that's all. It's not working to slow down a disease, and it's not looking to cure it. All right. So if they can attack a symptom, for example, a sign is what you see, a symptom is what you hear. Okay. So if the patient says, I can't smell, and they don't smell, or I can't taste, or I have pain, which is a symptom. Sometimes you can actually see pain, but because it's visually reported, you can't see the pain mechanism. But if you can reduce the pain neurologically, then that can channel where the research needs to go. So we're probably talking anywhere from 5 to 15 years before they make any really true progressions. I hate to be the bearer of bad news, but the only one that seems to be really getting anything done is Michael J. Fox Foundation. And hey, Aaron, good to see you. Miss you, buddy. Thanks for coming on tonight, Miss Becky. Um, Good to see you. Hope you enjoyed class last night. So that's the 7 miss. I'm sorry I'm mumbling, but it is in today. All right, so let me tell you what's going on. As you know, I took a couple of weeks off of the show and then had to take a break from boxing class because of some outside appointments. But here's what's been happening. Um, every time I take my Parkinson's medication, I become grossly nauseated and almost incapacitated with nausea. This has been going on now for 3 months, and it's really manifested. So, return to my doctor, and as always, right on it. And so we made a medication adjustment. And then I went to my primary care fella, excuse me, who I've known for 20 years. And so I'm going to have a CT done. And the purpose of that is so we can get a 3 to 5 level contour of visual contour of what's going on in the intestinal tract. To see, make sure, one, I don't have a mass, two, I don't have a blockage, but the abdominal pain on the left side and not being able to eat and enjoy food because I don't taste anyway. But the pain and the GI issues, and I don't want to be graphic, but the GI issues have come to a plateau to where it's time that we do something. In addition to that, my gait's changed significantly. It's gotten wider and I shuffle more. And that's been a big change since 3 months ago when I went to the doctor. So I've been referred to Duke University to the Movement Center. It is a Parkinson Center of Excellence. There's about 30 of them in the country, and we're fortunate to have Duke University as there. So I've been waiting about a week or so to get in. They're calling me, so I'll give it another week, and then if I don't hear back, I'll get up with my doc, and um, he'll get a burr under their saddle and get them rolling. He does a good job. Dr. Klein's a great fellow, good, outstanding neurologist, and saved my neck. I'll say that. So that's what's been going on with me. Not to get your sympathy, but I promised you when I first did this show that I would tell you what's going on with the disease process. In addition to that, some of you already know this, but I'm going to have to step away from Limestone as far as teaching responsibilities. And That is predicated on the fact that I don't have the mechanics in my hands much anymore to provide um, the quality of palpation, touching patients, and finding landmarks, and teaching my students those skills that they need when a physical examination and diagnosis is needed. They don't deserve what uh, I can't offer. They need somebody that's high speed, young, knowledgeable, has outstanding palpative skills. I got all the cognitive stuff in the 40 years of experience. My hands aren't working, and that's not fair to my students, and they deserve better than that. So I'll be stepping away in May, but hopefully I would like to get back on the board, support the college some way. Um, I can because I love Limestone. If it wasn't for her, I wouldn't be where I am. Met my wife there, coached there, taught there, served on several committees, and just been a wonderful role. It's been fantastic. Can't thank everybody at Limestone enough who had faith in and hired me. But the disease process has progressed a little bit faster than I thought, and it's time to move on. Yeah, and I did meet you, Bob and Paul and a bunch of other guys. So anyway, we'll close it out there. Folks, don't feel sorry. It's just part of the disease. And just want to let everybody know that we box on Wednesday nights at 7 at Strike Fit on West Warren Street. We'll also be boxing there tomorrow at noon. Have a nooner. And everybody is welcome to come out. You do not have to have a neurological disorder to be a part of our group. We love to have everybody there, caregivers, friends, and please come on board. Alex would love to have you. Would love to have you come box with us. Penny gives it some love and some thumbs up. We'll see you tomorrow. And Penny, I have something for you to look at that I talked to you about earlier. So everybody, y'all take care. Thank you for allowing me to ramble tonight. Love everybody who was on. God bless America. God bless all of our troops on foreign battlefields and at home protecting us. Law enforcement, EMS, and fire. Thanks a lot, man. Thanks for keeping my family safe. Love y'all now. Always remember, embrace the shake.